This is the Allen County Health Equity Coalition meeting, our first in-person since 2020, since well, I think February 2020. Okay, yay, yay, yay. So yeah, we can get a hand clap for this. I am Sharon Tubbs, for those of you who do not know me. But I'm Sharon Tubbs. I'm the director of Health Visions Midwest, and Health Visions Midwest oversees the Allen County Health Equity Coalition, which we will call ACHEC just to make it shorter. So we are so grateful for each of you coming out today. Usually what we do, because we are a faith-based organization, that doesn't mean that everybody in here needs to be faith-based, but we are a faith-based organization, and we do start out with a short meditation when we have meetings, and so that's what I'm going to do right now. I'm going to start out with a meditation. It's kind of like a little reading, actually. So I was thinking about relaxation because I have just been on vacation for a while. But it hasn't felt like a vacation. You know how you need a vacation after the vacation? Okay, so that's what's been going on. But I went to the Dominican Republic. Yay! Got celebrated for the islands. Yeah, and so, I had just a lot of fun. And so I'm actually still on vacation, but I'm interrupting my vacation for this meeting. But what I have learned is to relax is a good thing. Okay, how many of us in the work that we do in human services and social services and education and ministry and all of those realms that we touch on, how many of us are really taking time to relax? Okay. Well, y'all already know the value of it, so that is great. Everybody come on in. But relaxation is something that I have a hard time with because I like to do stuff. And so I like being busy. I like doing things, but relaxation is also good because now I have a little sore in my back and I'm like really wanting to relax. So I have a meditation this morning or a little reading this morning about relaxation. How can we relax and pray instead of running around with worry and anxiety? The giant red and white kite soared high against the deep blue sky with a tall half the length of a football field. The kite danced and tugged, pulling with all its might in a quest for more height. The kite flew high over the 6-lane road, filled wall to wall with cars and trucks that sped 60 miles an hour in a 45 zone. Racing from one green light, they charged in an effort to beat the next red light. All alone in the sky, the kite seemed to laugh at the racing congestion and mess of traffic down below. An old man held the string with a pulley contraption and sat on a comfortable lawn chair with a genuinely content smile on his face. He'd been sitting there all afternoon, relaxing, praying, and watching his kite dance. I wish I could relax like the old man. Instead, I'm often the woman waiting for the green light, racing to the red, pushing from deadline to deadline, list to list to get things done. Too often, my mind is filled with tasks to do, people to call, things to accomplish. More than 3,000 years ago, a wise King Solomon talked about this race we are running when he said, better one handful with tranquility than two hands full with toil and chasing after the wind. Ecclesiastes 4 and 6. So the question of the day is, who are you? Are you the old man who can relax and pray? Or are you racing with the world from light to red light? Are you Mary, who can sit content in the presence of God, or Martha, who scurries and worries? Do you have one hand of tranquility or two handfuls with toil? That's the question. Okay. So I want to leave us with that thought today. Who are you? Are you the one with one handful of tranquility or two handfuls of toil? And too often, in the work that we do in service to others, we are those who have two handfuls of toil. And I want to encourage you, like I'm encouraging myself, to live a life where I have a little tranquility, at least a little bit, despite the work that we do. Amen? Amen. Okay. So I want to go on and get started with our meeting. We've got some new faces today from the faces that I remember from 3 years ago, which was a long time ago. I hope everyone has, partaken in the refreshments that we have. If not, feel free to get up and do so. If you need to use the restroom, it's out the door and across the hall. So we want you to have that information. So just feel free and relax during this meeting. It is a meeting where we're going to have some great information from Mary here. But just feel free. It's kind of informal. We like to be a little relaxed, especially since I talked about relaxation just now. We are going to go around the room, and I want you to just say your name and your affiliation, what organization you're with. If you're not with a particular organization, that's fine too, okay? So we're going to start over here.
My name is Gabby Elman. I'm a community health worker, and my husband and I are pastors of Prince of Peace Church.
Okay, thank you.
Okay, give me 1 second. I'm trying to find you on my camera. So people online can see your beautiful faces. Okay.
Okay, we got our technology working.
You really did.
Are we ready?
Yes.
Okay, did they see Gabby? That's important.
Yes, they can see Gabby.
Okay, they saw Gabby, and Gabby is part of our Healthy Safe Sanctuaries program, and we're going to get that going a little bit more this year. So thank you, Gabby.
John Miller, Program Manager with Alzheimer's Association.
Connie Heflin, Executive Director for SuperShot.
Okay, bear with me. I'm coming.
Quick, let's.
Okay.
I'm Audrey Dominguez. I'm with the Allen County Department.
Oh, wonderful. That's a first time for the Allen County. But a lot of these are first timers. Okay, go ahead.
Okay, I apologize. I can't get this back, Sat down.
Okay, we'll see their hair in the back. Okay.
I'm Carrie Freiger. I'm with Great Heights ABA.
Okay, wonderful.
I'm Lisa Ackerman. I'm an independent health advocate, registered nurse.
Okay.
Brandy Shorey with Anthem Medicaid.
I'm Kathy Thornton with the Health Department, Director for HIV and STD Prevention.
Awesome.
I'm Valerie O'Brien, and I'm with AG and
Okay. Oh, so we got our 18 and home person.
Megan Stites with CareSource.
Wonderful.
Denise Porter Ross, representing River's Edge, but I'm retired.
She's not retired. Just stop it with that. Okay, go ahead.
I'm Keona Cox with Cancer Services.
Patty Dunn with Vital VCA.
Wonderful.
I am Autumn Trice Johnson. I'm with Purdue Extension.
Monty Rogers with Williams. I am with AID Residential Services.
Okay.
Melissa Fisher, I'm the lead pastor over at Faith United Methodist Church, and then also New Wave Wellness. We do behavioral, music, and rec therapy with the waiver. Adults and children with developmental disabilities.
Awesome. Monique is my classmate from Northside High School, y'all. Northside. Okay. All right. So our first person on the agenda today is.
Did you want to have the people on Zoom introduce themselves?
Oh, good idea. Can we see them?
Yeah, so when they come off mute, then they'll come on that screen. So we have.
Ooh,
there we go.
This is good. Oh, look at them. Look at the people on Zoom.
And then I guess I don't know how well they can hear me back here because the speakers are next to you.
Okay.
If you want to call them out and have them say their name and their affiliate.
Lovely. Oh, look at this. See how neat this is? Okay, all right. So since Raphael is waving, I see him waving first. Raphael, would you go ahead and introduce yourself?
Sure. Good morning to all of you. I'm based in Indy, and I work for Indiana Donor Network, that little red heart in the driver license. So it is all about educating the community in organ donation and transplantation.
Awesome. Okay. Emily Gorman.
Hi, everyone. I'm Emily Gorman from AARP Indiana. I'm also based in Indy, and I am the Community Engagement Director.
Wonderful. Sarah?
Good morning. I am Sarah Silva. I am the Operations Manager for Give Here in downtown Fort Wayne.
Lovely. Wonderful. Okay. Charity, can y'all see?
Hi, everyone. I'm Charity Story. I'm the Director of Education and Testing at Positive Resource Connection, and our focus is HIV, hepatitis, and STD prevention and linkage to care.
Michaela?
So I'm Michaela Dubb. I'm the Deaconess Intern at the Shepherd's Hand.
Yay, we love Shepherd's Hand. Yay. We love everyone. Kelsey.
Hello, good morning. I'm Kelsey Owen. I'm the AVP of Nutrition and Health Wellness Services with Aging and In-Home Services here in Fort Wayne, Indiana.
We got a couple aging and in-home folks. Wonderful. Cassandra?
Good morning, Cassandra Zine with Stillwater Hospice. I'm the Director of Business Development over here, and we provide hospice services in 12 counties in Northeast Indiana, along with grief support.
Awesome. Okay, Joyce. Joyce, you're on mute.
Yeah, I'm mute.
You're muted still. Joyce, do you know how to unmute? Oh, maybe her audio didn't connect? Okay, because you can't unmute her, can you? Okay, Joyce, we're gonna come back to you. Maybe, can she type in the chat? Maybe you can type in the chat. Okay. Pat Turner.
Good morning, Pat Turner, Tobacco Education Coordinator with Tobacco Free Allen County.
All right.
And the Neighborhood Association Chair of Little Res.
Thank you, Melissa.
All right, she's got a lot going on there. And then Jeff?
Oh, sorry, didn't hear you. Good morning. Jeff Markley. I'm the Executive Director of the Positive Resource Connection. So I work with Charity. We serve 12 counties in Northeast Indiana with HIV, AIDS, and hepatitis C services.
Awesome. And then Joyce, did you get your thing working?
I did. Sorry about that. Good morning, everyone. Joyce Lothamer with United Healthcare.
Wonderful. Okay. All right. Was there anyone that we missed? Because the videos changed around a little bit for me.
I don't think anyone that had their camera. But we also have Anne from CTN.
Oh, okay. Go ahead, Anne.
Hi, I'm Ann Harlem, Director of Administration at CTN.
Lovely. Okay, isn't this wonderful? This is great. Yay! Thanks, everyone.
I'm sorry.
Yes.
We have Laura Dwyer on the line.
Oh, okay.
And Jared.
Okay, we got two more people on the line. Laura.
Good morning. Laura Dwyer from Catholic Charities, Fort Wayne, South Bend. We run over 20 different programs for very diverse, vulnerable populations.
All right, thank you, Miss Laura. Laura's also on our council, on our advisory council, as is Connie Heflin over here. Okay, who else?
Jared.
Jared.
Hey, good morning. Jared Blanchard here, Purdue Extension here in Allen County. I'm the Community Wellness Coordinator.
Okay, awesome. So we've got a couple of Purdue people. We've got a couple of folks from other organizations who are double representing, which is wonderful. We love it. I'm sorry. Okay, Peggy. So we got a couple people from different organizations here, and we love it. So let's introduce staff. Peggy.
Peggy, I'm a community health worker and health worker trainer.
Lupita, the Banking Community Health Worker working with Latino community.
And I'm Felicia, and I'm the administrative assistant in the virtual community programs.
Okay, anybody else need to be introduced?
You.
I said myself in the first. I'm Sharon Tubbs again. I thought I introduced myself first. I'm Sharon Tubbs again with I'm the director here at Health Visions Midwest, and we oversee the Allen County Health Equity Coalition. Anything else? Any other introductions? Okay, so I'm going to start off telling you one of our presenters today, Tony Gillespie, could not be here with us. He was going to give us our legislative update, but he got sick this morning and his voice is not working. He was going to stream in from Indianapolis. Health Visions Midwest is an affiliate of the Indiana Minority Health Coalition, so he is the policy person, I forget his exact title, but policy engagement with IMHC. And so we will have him on in a future meeting, or we will be able to send out some of the information about the different policies and bills that are streaming through the legislature that we need to keep an eye on. But that just gives us more time. For our main speaker here, Mary Tyndall. And Mary is a lovely woman, as you can tell. But Mary is doing some really great things with the St. Joe Community Health Foundation and food programs and working with grants. And she just got a new title that I forgot. And so she's going to tell you what that title is and all of the wonderful things that they're doing. I wanted Mary to come and talk at the beginning of this year because the food programs statewide, there's a big transition going on here, okay, with underserved residents throughout the state and in Allen County, of course, and ways that we can help people to eat healthy foods. Okay, eat healthy fruits and vegetables. We can't talk about people living healthier lives if they don't have the resources or the access to the foods that they need to be healthy. And so Mary has been doing a lot in that realm with farm markets. We've worked together with the Heal Farm Markets, which you may or may not know that Health Visions operates Heal Farm Markets from July through October, and that is through a grant with St. Joe Foundation and Parkview Health. And so Mary is involved in all of that, and she's got a presentation she wants to show you all, and I'm gonna shut up while she does it.
Well, I hope I can live up to Sharon's expectations. I do have a cold today too, so that's why I had my mask when I came on, and it's okay, I'm gonna take it off during the presentation. I recovered from COVID a month ago, so it's not COVID, but I do have a cough and a cold, so just kind of wanted to tell you, bear with me if I need to put a cough drop in my mouth. And then I know there's a lot of partners in the room that we partner with regularly. Jared Blanchard and Laura Dwyer have a lot of experience with farm markets, aging and in-home services, obviously the folks here at Health Visions Midwest. So Denise is, of course, our longtime HEAL supporter. So anybody who wants to chime in, I would really appreciate it because I've only been at the St. Joe Foundation for 2 years, and so I have some experience, but I certainly don't have all the experience. So thanks for having me here. Just a little bit. Oh, I forgot I had to do this.
It's being a little funny, so maybe just.
It's over there, so I have to.
Oh,
right?
no, sorry. It's not letting me put it in full screen mode.
Oh,
so.
that's okay, probably, right?
Let's see if I.
Is it working?
Okay. Okay, I'll push it down for you real quick, Mary.
You're gonna, yeah, because I don't know if it'll
Yeah.
work over there.
And
Okay.
just give it a second. There we go.
Okay. So just a little bit about the St. Joseph Community Health Foundation. We are a sister ministry of Health Visions Midwest. We're both sponsored by the Poor Handmaids of Jesus Christ, a religious order of sisters based in Donaldson. We were expanded in 1998 when the Poor Handmaids sold St. Joseph Medical Center, St. Joe Hospital, and they took part of the proceeds and put it into the foundation so that we could do some grant making. And we've distributed more than $20 million. I think it's probably more than 22 million now since 1998. The next one. So real briefly, the impact areas for the St. Joe. The next one.
It's coming.
Oh, okay, it just takes a little bit of time. You warned me. The impact areas for the St. Joe Foundation are what you see on the screen. So we do more than just food insecurity and nutrition. We work with a lot of partners in here in other areas, but what I primarily work with is nutrition and food insecurity. So that's what I'm talking about today. Next one. We have specific goals for each of our impact areas, and this is the one that we have for nutrition and food security. We try to mention food insecurity, but also really emphasize nutritious and culturally appropriate food choices, and that people have opportunities to learn about nutrition and healthy cooking techniques. So we try to focus on all those areas. Next one. I'm sure most of you already know what a definition for food insecurity is, but the USDA defines it as a limited or uncertain availability of nutritionally adequate foods. And this can result in the households needing to make trade-offs, and I'm sure we see that all the time. You know, should I buy my medication or should I go to the grocery? Should I pay my rent or should I go to the grocery? And so those kinds of trade-offs are really common in all of the areas where we work.
I'm sorry, Mary, could you see that box that's kind of on the table? Could you bring the little microphone back?
Oh, this guy?
Yes, they're having a little hard time here.
Oh, I'm sorry. Okay.
Bring it, there we go.
Is that good?
Yes, there we go.
Okay,
Try that.
better? Okay. Let's see. So the next slide, if you would. So we know about food insecurity, but the USDA is really changing some of its language to focus on nutrition security. And by this, they're talking again about consistent access to nutritious food that supports optimal health and well-being. And so they're really focusing on the diet-related chronic diseases that are the leading cause of death in the United States: cardiovascular health, high blood pressure, obesity, diabetes, those kinds of things. So they're trying to emphasize the health aspects with nutrition security, and they're also trying to emphasize the importance of tackling long-standing health inequities, which I'm sure everybody in this room is familiar with. Research shows communities of color, families with children, and people in more isolated areas of the country, including tribal communities, are disproportionately affected by the toll of diet-related chronic conditions. And so by the USDA referring to nutrition security, they're trying to bring attention to all these issues. So I try to refer to that as much as possible as well. Next one, Alicia. Just some updates on food insecurity rates in Allen County. We tend to hover around 12%, which is about 45,000 people in Allen County. And when I hear that 45,000 people, it just really, that's a lot of people in Allen County, right? That sometimes are needing to supplement with a food pantry, or they're just not eating maybe as much as they would like to, and they're giving more of their food to their children. 45,000 people is quite a bit. For Allen County, we only have statistics that go through 2020 because it takes longer to get that very small data. But the US Census does do food scarcity rates, and they update those a lot more regularly, as you can see. Those are just for Indiana. They don't go down to the granular level in Allen County. But again, those have been hovering around 12.5%. Oh, and something to talk about there is that about 25 to 30% of the people, that are food insecure, they don't qualify for any government benefits. So they don't have SNAP and they don't have WIC. They're at 185% of the poverty level or above. So they don't get any government assistance for food. And that's really why we still need a variety of sources of help, such as pantries and food banks, because the government can't do it all. Next one. I'm sure most of us are familiar with this because Sharon and her team really did an excellent job of highlighting food deserts in the Food Exodus documentary that they rolled out 2 years ago. Has that been 2 years? Or just last year? Just last year. So food deserts are low-income tracts where there is not easy access to healthy food. And I suppose it's not surprising that we have food deserts in some of our low-income areas in our community. And when I was looking to see if they had any updated material on this, I ran across an article on the USDA website that also said that when in areas of food deserts, they're often accompanied by food swamps, which is a term I had never heard before. And that just means that they're referring to a real easily access to candy and chips and soda and pop and everything. So you can get your hands on, a big gulp really easily, but you can't get your hands on affordable, fresh and healthy foods in the food desert areas. So something I think we all are aware of and trying to combat here in Allen County. All right, next one. I referred to SNAP benefits. I thought this might be interesting just for some people to know. For individuals in Allen County who receive SNAP or food stamp benefits, we're putting out about $6.3 million per month to residents in Allen County for SNAP or food stamp benefits. You can see that really spiked during the pandemic because there were those extra pandemic benefits, which is a great help and really lifted a lot of people out of poverty. But those have fallen off now. They did make an adjustment for inflation, so they're a little bit higher than they were pre-pandemic. But generally, I looked up the latest numbers, and in January of 2023, it was about, again, at $6.6 million per month for SNAP. So that one. Next one. There we go. So some of the things that the St. Joe Foundation does is we provide grants, and that's kind of what you would typically think that we would do, that a foundation would do. We provide mini grants and larger grants to some of these partners you see on the screen, all doing great work. Community Harvest Food Bank, Miss Virginia's, some of the traditional ones that you all know. So that's exciting work, and our partners are doing incredible things to really provide healthy, fresh food to the people that they serve. Next one. And then, as Sharon referenced, we also are a part of the HEAL initiative. And I believe this began in 2012. Laura Dwyer's on the call, so she might know better. Correct me if I'm wrong, Laura. But the HEAL initiative, I believe, again, began in 2012. It's Healthy Eating, Active Living, and it's a partnership with Parkview Health. And these are the goals that you can see: increase access to healthy food and affordability, awareness of nutrition and cooking skills, and also, really importantly, increase consumption of fruits and vegetables so that, oh, thanks, Laura. I saw that. Thank you. And really important that we can affect health outcomes by helping residents prevent and manage chronic diseases. And research shows that even increasing fruit and vegetable intake by ½ cup every day can have significant health impacts. So I know Denise knows all that kind of information. So even if people think it's really hard, but you just eat an apple extra a day, and it really can help your health, regardless of what else you might be doing in terms of exercise or diet, those kinds of things. So next slide. So the first part of HEAL is the Healing Kitchen curriculum. It's a garden to kitchen curriculum that was written by Parkview dietitians, and I have the latest version here. It's a little bit of a fancier cover. It is filled with so much information. There's all kinds of nutrition information, but then there's wonderful, healthy, affordable recipes in here as well. So everybody who takes part in an OHK class, as we call them, gets one of these books to take home with them. And the goal is to teach participants how to select, prepare, and incorporate fresh produce into their diet. Next one. I would be happy to. I know. I think Denise knows like every page of this thing. She could give this presentation a lot better than I could.
I'm guessing questions are at the end.
You can talk now if you want to.
I
Sure.
was going to ask, how specifically do you, because I think our church would definitely be interested in having this program, but where does the applications go and how does that?
Thank you, Melissa. That's awesome. I'll pass these around too. I'll go this way so I don't trip. So we are opening grant applications March 1st. So really soon they'll be open for the whole month. Yeah, it's like you planned it, right, Sharon? Is that what you're saying? You planned this. Perfect timing. Perfect timing. So yeah, so we're opening them March 1st. It is an easy application to fill out, but if anybody has any difficulty, just contact me and I will help you do that. So there's a link on there, and the grants are open to apply through the whole month of March. Okay. Yeah.
Mary, you said that it's okay for us to expound upon things, but so I just want to let you know that, it's just an awesome program. And you can get like kitchen supplies and materials, those at Dollar Tree. You can grab those and you can use those to cook with and give incentives and gifts and things like that to them.
Yeah.
And just at the end, like cookware or anything like that you might want to give to them as a gift or something like that. So it's fun and it's what you make it, and it can be a lot of fun, and they learn a lot. And like for instance, last year with my class, I did got the little salt shakers, and we did like the Mediterranean or the Cajun spices that's in the book, and we use that. My class loved it, and they're still actually using that. So just little things like that.
Awesome. Yeah, Sheila Perkins told me they did at Pilgrim and it's gone really, really
Yeah,
well.
there's
So,
Pilgrim. There's
We
Pilgrim,
send our
there's Mother's Hope.
individuals At AID, we send them to Shepherd Hand
Yeah.
for the class.
Which she's on the call too. Yeah.
Do you have any in Spanish?
We do, we do have, some of the material has been translated into Spanish, so yes, we can provide that.
And while you're saying that, we did work out something with the league a few years ago to take some of the recipes and put them in Braille.
Okay, okay, I did not realize that.
A couple that doesn't see how to cut a tomato.
Yeah,
That's so
yeah.
awesome.
Yeah,
Yes, my individuals, they loved it. They got the book and then they got like measuring cups and things like that. And so they actually enjoy the meal together after they make it in fellowship.
Yeah.
And then they go home and they tell everybody how they cooked. Even
Yeah.
if they didn't do anything but chop celery, it made them feel a part of the
Absolutely, it is. It's really, we hear great stories from the responses that we get back on our reports. Peggy?
I know when I attended this, one of the churches, one of the things I loved about it was the kids.
Yeah.
They got to participate, they got to chop vegetables, and they actually, because they participated, they were willing to eat more of the food.
Absolutely.
Eat things that they normally would not eat, and it was just a joy to see families around eating together.
It is.
Because, everybody's so busy, we don't eat together. And to have that, that particular time, they knew that everybody was gonna be eating as a family together and meeting other families, it was just great.
It is, and there's a lot more to food than just nutrition. It's community as well, and we hear that consistently, and that really brings joy to our hearts as well. That these relationships, especially when seniors participate in the class, if they're isolated, but then they can come together and share a meal, and it really helps form a community too. So we have a lot of great feedback over the years, and there's been, since 2016, more than 2,600 participants, 204 cohorts, and 149 grants to churches and nonprofits. So a lot of groups.
Can I ask 2 more questions?
Yeah.
So like, what's the time commitment of it? And then 2, do you have to actually like execute it? Or are there volunteers that will come alongside and help that have done it? Or is it a supportive?
Yeah, it is supportive. It is a time commitment though. So if you're going to teach it, you go to a 2-hour training with the Parkview dietitians, and then some of our longstanding teachers will also be there and provide support and tips and that sort of thing. But then you go back to your church or your organization and you decide, it's either a 6 or an 8-week class. You can do any time or any amount in between there. We want to make it as flexible as possible. So every week you'll teach a class, and you do need to prepare to teach it, and you need to purchase the food, and so there's Kanya, you can talk about that. There is some effort that goes into it for sure.
Yes, you definitely, it is time consuming, but it's worth it. Because you have to go to the grocery store every week, and so they have a set recipes that they would like for us to do. And so you go to the store and you purchase the ingredients for everyone to be able to make the meal. I think the first one is salads. And then after that, you just bring it back and then just, teach it to them and just let them have fun with it. And like Mary said, like 6 to 8 weeks. And then in the end, you have a celebration dinner with it.
Yeah.
Okay.
And you can do a click list or that kind of thing too. If you want to order your groceries, go pick them up, to make some things easier if you'd like to. Yeah.
So I see a price on the back. Can we buy that retail for donation or?
Yes, so the Parkview, what's the name of that center? Parkview Healthy Wellness Center or something like that. I can find out the exact name of it. They do sell them there, and then they take the proceeds and put it back into the HEAL program. Yeah.
Is there an age range for these?
Well, so that's a really good question. Is that our next slide? Not quite yet. Hold on just a second. Okay, so let's go to the next slide. There are some kids here from Pilgrim Baptist Church. The results are really nice. We asked people to take surveys to do a pre and post survey that the researchers at Parkview help us look at. And people are increasing. Oh, Parkview Center for Healthy Living. Thank you, Jan. It was something like that. Can you put, she put the phone number on there too. So thank you so much. So people are increasing the amount of vegetables and fruit that they eat from pre-survey to post-survey. They're also increasing their confidence level in being able to prepare affordable and healthy meals for their families. So we find that really encouraging. Again, that increase in fruit and vegetable consumption is something that the USDA looks at in all of their program evaluations. So we feel positive that this is having that kind of an impact on the people we're working with. So, next one. Notes here. So then kids, here we go. So we did get a grant from the State Department of Health this year, and starting Friday, they are going to start implementing our Healing Kitchen for Kids in all of their 7th grade science classrooms. We're a little nervous. Yeah, woo is right. It's quite an undertaking because it's more than 2,000 kids. So I have been schlepping big buckets of measuring spoons and, paper products and all kinds of things over to Fort Wayne Community Schools so that they can take those and put them in their classrooms. And it's, it's a pilot. We'll see how it goes with that many kids, but we're really enthused to be launching this. And there are some more kid-friendly recipes in there and some more kid-friendly activities. And also there's a survey that's designed specifically for kids in this material as well. So we're happy to have that. So if we get grant requests this year with kids, we'll direct them to this material because it'll be a little bit more kid-friendly. So exciting. Oh, and we do need volunteers in the classroom. They're trying to get volunteers to go in and help the science teachers. If anybody is interested, just let me know and I can hook you up with Gina Dundon is in the Health and Wellness Department at Fort Wayne Community Schools. She's coordinating it all. So we hope it goes well. So everybody say a prayer for that. That's a lot of kids. Okay, the second part of HEAL is the HEAL Markets, which is operated by Health Visions Midwest of Fort Wayne, and they do a phenomenal job. It's a lot of work. They operate 3 markets in food desert areas at McCormick Place, at Southside Market, and at the Parkview Greenhouse. So a lot of work during the summer months. The WIC office and Aging and In-Home Services are on site, and they provide the Farmers Market Nutrition Program vouchers on site, which is really helpful. The participants in those programs can come get their vouchers, and then we also match those vouchers $1 for $1. So if they get $50, is that right, Felicia? Did we do as much as $50? Yep, this year? Okay.
I think for Aging and Home they were in $40 increments,
Okay.
And then we matched the 40, and then with WIC it was in $30 increments.
Okay. So that's quite a bit of money to spend on fresh fruits and vegetables. There's a little hang up this year with the vouchers being late coming out, but Felicia and the team at Health Vision still did an excellent job. And so they matched the WIC and the senior vouchers, all the SNAP purchases, and they also take Veggie RX, which is a Parkview program. Super successful. If you want to go to the next slide, are some of the results. So last year, even though the WIC vouchers came out super late and senior vouchers came out super late, there were more than $50,000 in fresh produce purchased by WIC families, seniors, and SNAP families. So way to go. I mean, that's a ton of work. And then $18,000 of that was the matching dollars provided by Parkview and St. Joe. I did not include Veggie RX in that because I didn't know that, but I'm sure that was significant as well. And they did a great job of recruiting several Burmese farmers this year to visit the market, as you can see right here. And that brought a lot of participants as well. So that was really fantastic to see, and it really increased the SNAP sales as well.
I'm sorry, Mary.
Yeah.
We ran out of the flyers. Is there any way that we can make copies?
Oh, sorry about that. I didn't bring enough. Thanks, Peggy. So then an initiative that grew out of the HEAL Markets is Double Up Indiana, and St. Joe Foundation applied for and received a $500,000 4-year GUS grant from the USDA, which is the Gus Shoemaker Nutrition Incentive Program. It's a mouthful. Awarded in September of 2020. It's a matching grant, so $500,000 from the federal government to be matched from local sources like St. Joe and Parkview. And what that provides is a $1 for $1 match on fresh fruits and vegetables at participating locations when participants use their SNAP benefits. So, well, I'll go to the locations next. They're on the next slide. But so far in 2 years, we've redeemed more than $187,000 in free fruits and vegetables. So that's $187 worth of fruits and vegetables that SNAP families would not have had otherwise to take to their families through this program. So really happy about that. And well, I'll go to the next one. The next one, if you would. These are the locations right now. The year-round locations are the Three Rivers Food Co-op, the Health Food Shop, and then Fort Wayne's Farmers Market. Is that on there? Yes, which in the winter operates at Parkview Field. So, and then you can see the other locations that operate during the summer months. Next one. So the results from this are also very encouraging. We participate in surveys set up by the USDA, so they're standardized across the country. So it's not just people here in Allen County that are taking these surveys. Again, they're taking them across the country. And the information that they get shows that that people participating in Double Up programs eat more fruits and vegetables than the average American. So that's pretty impressive. They're pretty excited by that. So really increasing that fruit and vegetable intake. And then their findings also show that that's clinically significant, given prior research which demonstrates that every increase in fruit and vegetable intake has a protective impact on health. Again, so even a half a cup of fresh fruit or veggies every day additional can improve your health. So happy to see that those results are so encouraging. And because those results are encouraging, if you want to go to the next one, if you would.
Will we receive these slides?
You sure can if you want to.
That would be great.
Absolutely.
Just, do we put our name on a list, or you'll just send them out to?
I can give them to Felicia, right?
Okay.
Yeah, that'd be great. So we are hopeful, am I going too long?
No.
Okay. Okay. We're hopeful that Double Up programs will be adopted throughout the state of Indiana. Many states in the United States already have Double Up programs. Indiana's just a little bit slow to ramp up there. So we're hoping that there will be a statewide network of Double Up. And we've received a $200,000 grant from the State Department of Health to grant out to farm markets throughout the state so that they can implement Double Up programs. And we're excited about that. We have $45,000 already granted out so far. Evansville, West Lafayette, Dunkirk even. So we're really working across the state so that we make this sustainable and hopefully go for a larger grant from the USDA so there would be consistent funding across the state of Indiana. We hope that'll work. We'll see. And Jared's on the call. He's been really helpful with that. So if you have anything to offer, Jared, put it in the chat or come off mute. And then there's just two more slides about emerging opportunities. I think a lot of you have heard about the Pontiac Street Market. That is a partnership between the city of Fort Wayne and Parkview Health. And they will, thanks Jared. And they will take Double Up there, WIC, and Veggie RX at this location. I've been told that they hope to operate or to open this fall, so soon. And they're operated in conjunction with Sodexo, which does Parkview Nutrition Services. So they will have the experience to actually provide the operations of the grocery store, and it will be full service. They're still raising money to complete an upstairs teaching kitchen and have services up there as well, health services up there. The last one is Electric Works, Union Street Market, if anybody has been there. They're working on building that out, and Jane Young and Plowshares or Heartland Communities with a lot of Burmese farmers are going to be opening a stall there, I think within the next couple of weeks, to provide fresh produce. So that's positive. SNAP and Double Up will be accepted at her stall. And then I've learned, well, I saw on social media actually, that Fort Wayne's Farmers Market has signed an agreement to locate in Dynamo Alley, which is, I don't know if anybody's been to Electric Works, but it's that big long alley in the summer times, and then they'll be inside of Electric Works during the winter. So they plan to make sure that they accept all the nutrition incentives, the Veggie RX, the WIC, and all of that as well. So that's a positive thing. And that's what I have. Any questions or comments?
Questions? I do have some from our online participants. Sorry, I'm trying to make it so that they can all see you. Okay.
Jeff.
Okay, so from Elka Jackson, she asked, where, and this was the numbers that you talked about at the beginning where you were talking about, the different percentages of people being food insecure. So she asked, where do these numbers place us in comparison to other countries, counties and states?
Well, that's a good question. From what I recall, I think Indiana sits somewhat in the middle, a little bit higher than the national average in terms of food insecurity rates, but we're not at the bottom, but a little bit higher than average. In terms of Indiana, I believe that we always tick up a little bit higher than the whole state of Indiana, but we're somewhat similar. We have higher population and we have some higher pockets of low income areas. So we are a little bit higher, I believe, than the rest of the state, but it's not dramatically higher.
Okay, and then is it helpful for the community at large to shop at the Hill Market? Would our goods purchases help supplement the market, or would we be depleting the resource?
Felicia, how do you feel about that? I think it would be wonderful to have everybody. We really want it to be a market for everybody. We don't want it to just be a WIC market. That's not really what it's supposed to be. It's for everybody. It accepts cash, credit. I mean, I buy, my fruits and vegetables there. We would love to, and they're locally grown. So, they're healthy. They haven't traveled, all the way from Hawaii or wherever. So they're healthy, and it would support the farmers primarily. In the market, the sustainability of the market as a whole, there's no profits per se that go to Health Visions or, we're all nonprofits, but the farmers make money. So they would appreciate that, for sure. Anything else, Felicia?
Does the Hill Market have, or can they consider a set-aside program to provide vouchers for domestic violence survivors and their children?
Well, that's a really good thought. I guess I would like, whoever that is to reach out to me. I'd be happy to talk to them about it. I think that would be something that Parkview and the foundation would probably need to fund and then provide a voucher or a coupon to the shelters. So I think that could be done.
And then the only thing left is people want your contact info.
Oh, I have my card up here for anybody that's in the room. And then I can put it, or Felicia, you could put it in the chat, or okay.
And the link to the application, do I find that online to put in the chat?
Yes, it's in that flyer that's going around, but I can help you put that in the chat.
Okay, and Mary, you do also already have classes at some of the domestic violence.
Right, so at the Y they have a wonderful OHK class. It's one of the best. It's absolutely, it's one of the, it is so great. Yeah, the feedback from those surveys are tremendous.
Yeah, and I know in the past there have been classes at Genesis Outreach, transitional housing.
Yeah, really the classes do really well in the transitional living. And Denise has them at River's Edge. You kind of have a captive audience there and a little more time to put into it. And it's a really all the results and the surveys I get back are just so encouraging.
And the one with Tommy Carden?
Yeah, Redemption House, they do that as well.
Yes,
so Shepherd's Hand has a great, that's not transitional living, but yes.
So some of that is already in the works.
Yep.
So great program, Mary. I'm glad we got you in right before the grant period started, so y'all can fill out the grant applications.
I'll put this back on.
And so, they're doing some great work.
Denise,
any other questions?
This is not your new title. Can you tell us?
It is, I think, isn't it? Yep, that's my new title.
CEO now.
Okay.
Oh, no, I don't think.
Tell Meg Nisler that.
No.
Was unaware of that.
No.
Yeah, her former title was chief storyteller.
Yeah.
She was telling a lot of stories.
Yeah, I was. How about you?
Okay, one more
Hey,
question.
Sharon.
Okay,
Sharon.
Okay, yes, Elka. Yes.
Hi, sorry, this is Elka. Hey, Mary, who did you, that question was from me, that last question about survivors. Who did you say I should contact? You said you or whom else?
Sure, you can reach out to me, Elka.
Okay, great. Thank you so much.
Yep, just send me an email.
Okay, thank you.
Awesome. Kiona?
Mine was just real quick. Will it be the amount that it technically is like the 1,500, or will we have to kind of do like we did last year, or?
Well, we don't have quite as much funding this year. That is a challenge this year. So it's definitely not going to go up, unfortunately. So, yeah.
So the grant amounts?
The grant amounts will still be, they range anywhere from 500 to 1,500. And
500.
we ask you to kind of base that on how many people you might have in your class. So you have a larger class, you need more food and supplies. Smaller class, you probably wouldn't need as much.
Awesome. Okay. One last question.
Quick question. Are any of the current classes like open, or do you have to be like?
To the public?
Yeah.
So Brightpoint has in the past applied for grants so that they can open them up, and the YMCA at the Jackson Lehman facility has opened those up to the public too. We do request that those classes be primarily vulnerable populations. So if somebody can afford to pay for the class, that would be okay too, you know, but we would really like to reserve those for vulnerable populations and low income.
Okay, so what we want to do now, thank you so much, Mary. Can we give Mary a hand? So we want to transition now and talk a little bit about some of the upcoming things that are going on with your organizations and with ours. So here with Health Visions, our next ACHEC meeting is going to be an event. And so I wanted to make sure that all of you are familiar with this. We've sent out some information about this already, but if you could go on ahead and take a flyer, and those online, you have received it for email, I'm sure. But we want you to know about the Rethinking Health event that's coming up. Last fall, when we did our Rethinking Health fundraiser, we talked about raising the awareness in the community about health equity and the need for that. So I hope if you weren't there, you can see the talk online on our YouTube page from that Rethinking Health Breakfast. We had a panel discussion with representatives from the various hospital systems, as well as a keynote speaker from the CDC. And so we want to keep that going, that conversation going. We had a survey, y'all said y'all wanted to keep it going about health equity. And so we are bringing a speaker in conjunction with United Front, the City of Fort Wayne's United Front effort. We're in partnership with them to bring a speaker here, Dr. Virginia Kane. And Dr. Kane is the Director and Chief Medical Officer of the Marion County Public Health Department. And she does a lot of speaking about health equity. And so this topic that she's going to speak on, I'm sure you guys will be intrigued. You guys and gals, women and men, are going to be intrigued. Racism and health equity. She's going to be talking about the impact that racism has on our health. We don't think about it in those terms a lot, but racism is bad for your health. Prejudice, it's bad for your health. The microaggressions, the trauma, the stress, the various impacts that racism can have on individuals, people of color, African Americans, Latinos, Burmese, people in our community. It affects your health. It affects your access to health, but it also affects your actual physical health. And she's going to talk about those things. She's going to talk about implicit bias in our medical field. So you don't want to miss this, okay? You want to be in the house for Dr. Kane. And so that's going to take the place of our March ACHEC meeting. Is going to be on a Thursday, and it's going to be a luncheon, okay? It's on a Thursday, and it is a luncheon. So I want you all to be aware of that. It's from noon to 1:30. It's going to be at Indiana Tech, not here, at Indiana Tech, and it's in conjunction with United Front. United Front's been doing some wonderful things over the past couple of years, dealing with diversity, equity, and inclusion. So if you're not familiar with that effort, I entreat you to get online and look up United Front and become a member of their monthly, or I think their quarterly talks that they're doing this year. And so this is part of that effort. But what they don't touch on with United Front is health. They talk about workplace and some of those things. And so we are just honored that they have talked to us about getting this health piece out This is open to the community. This is open to the community, yes it is. Now, ACHEC members, we got something special for y'all. Maybe it's, I think we're doing reserved seating and things like that for ACHEC members. So get online, register now. We can't accommodate everyone. So register, get online, register now at the registration link for that event. Again, that is a do not miss event. And so, am I missing anything that we need to talk about for health visions? Anyone? Anything else going on with health visions that we need to talk about? Felicia, Peggy, Ruby? Okay. Okay, so that's what we got going on. Now I want to open up the floor for you guys to talk about what's going on in your world. And so this is open to people online as well. What's going on in your world? What do you want to tell us about? Denise. And so when you talk about what's going on in your world, repeat again your name and who you're with, and then talk about what's going on.
I am Denise Porter. I am with everybody, but for this particular component, I'm going to mention AARP specifically because Emily is also on the call. They have an ongoing legislative committee that devotes itself to being at the State House this time of year, watching what's going on for each bill. So for those bills that you want help with somebody's eyes on the floor, let Emily know. I went down with them. It's not my bag. I did my government stuff before, but I know who you need to talk to when you're down there. But Emily can help with any of the bills that you want to see or have input on.
Okay, so we need Emily's contact information. We need to know more about Emily. Emily Gorman is right there. Emily.
I'll put my contact information in the chat for everybody. So thank you for saying that, Denise. I appreciate it.
So Emily, we were going to have a legislative update from Tony Gillespie with IMBC. I talked about that a little bit at the beginning. And he was going to talk about a couple of public health bills that are being considered right now. Do you have any information on those?
I don't, but we have our legislative director, Amber Marr. She's the one who's across the street working on all of our state stuff on behalf of AARP. I can get her to give us an update maybe via email to this group. Would that work?
Sure, and Tony's going to give us some information as well. I just didn't know if I was putting you on the spot there. If you know, I know there are a couple of bills that are being considered in terms of increasing funding for public health throughout the state of Indiana. And I don't have those bill numbers in my mind right now. But if anybody knows and can hip us to that, then that would be great. If not, then we will send out some information via email.
And put Tony and Emily in contact with each other too.
Okay.
Thank you.
Okay. Okay. Who else has got some stuff going on? Keonya.
Once again, my name is Keona Cox, and I'm the Southeast Liaison with Cancer Services. So I'm not sure if many of you know, but last year, Cancer Services branched out to the Southeast side. And so we really work in terms of like having like support groups and just different things going on there. So Mondays, March 6th, we'll start Tai Chi, and Tuesdays we have stretch and strength, and Wednesdays sometimes we have Reiki, and then Thursdays we also have chair yoga. And these pretty much take place, the exercise classes from 2:30 to 3:30 p.m. I have a card. Some of you received it, some of you didn't, so I'll give it to you. But there's just other programs that also happen, like painting classes and just different things like that. So if there's interest, grab some cards from me, and you can pass them out to anyone who's interested, or just put them on your site. So.
Thanks, Keona. So we encourage you, when you come to these meetings, to bring your flyers, and we'll have them, you can put them out and people can get those and learn more about your events and upcoming activities. Anyone else? Pat.
Good morning again. So we are once again asking the legislators to increase the cigarette tax by $2. And so we need all of you to be contacting your legislators and encouraging them to do that this time around.
Wonderful. So Pat is with Tobacco Free Allen County, and they have been trying to get the tobacco tax increase for the past, how many years?
forever.
And so we do this every year, and I think,
Every year.
didn't they increase it by 50 cents?
Yes, that's not enough though.
Right, it was, and so in other states, the tax is much higher.
Much
as a
higher.
disincentive for people to smoke. And so, as we know, TFAC does some great work with underserved populations and how the tobacco industry actually preys on underserved areas, under-resourced areas, targeting those areas for tobacco usage. Okay, it's really very predatory. And so,
Very.
yes, and so we've been trying to get that tobacco tax raised. We need to do that. We need to keep talking about it. And so hopefully, Pat, you guys can give us some more instruction about how to.
We can send you some information.
Yes, they're gonna send some information about how we can get this thing. Okay.
And actually, if anybody wants a upcoming program, Ms. Pat will be with me, April 17th from 5:30 to 6:30 p.m. at the Impact Center for a program, so come out.
Okay, she's gonna talk about tobacco, obviously,
Yes.
Tobacco cessation.
Obviously.
Yeah, Pat did a program with one of our Healthy Safe Sanctuaries churches last year. And one guy came, right, Pat, with, I think it was Christchurch. Anyway, Pat does this all the time, okay? I was told the man had been smoking for 40 years, okay? He went to one program with Pat. He doesn't smoke anymore. Wow. That was it. I don't know.
He was ready to quit.
Okay, well, come on now. Okay,
I'll take a little credit, but he was ready. You have to be ready, and he was ready. He received what I offered, so yeah.
Yes, yes. So anyone else, any other announcements for your organization? Yes.
Well, I'm Patty from the YWCA. We are hosting our second annual Race Against Racism on April 29th at PFW. It's open to the public, but this year we're focusing on building equitable health. So we are asking for community partners to table the event. It will be outside near Wald Union. So if anybody from your organizations would like to be present at it's a 5K walk and run. If you want to have a table and pass out information, if your organization would like to sponsor, we're always looking for more sponsorships too. But I have flyers here, sponsorship opportunities, packets as well. The more the merrier, if we can get out as much information to the public.
Yes, and we are putting together a team for that. Did I tell you? Yes, we're putting together. Yes, we're going to have a team. So if you want to be on our team, let us know. We're getting that together because we want to support that walk.
Yeah, that's something new we're doing this year to kind of help with fundraising. All the money raised for this will go to our racial justice programming.
Yes.
So we have teams, so it's a little bit more fun. Then we also have a Couch to 5K guide, and with that guide is really great. There's podcasts, the documentary is on there. So we have all kinds of different resources. Pearson, that document, so you know, it will say run 20 minutes and then the next day watch a movie and relax a little bit and take a little bit of relaxation time. So the guide is on our website too, so you don't have to participate in the race to take,
yes.
Use that guide, yeah.
Yes, awesome.
Can you pass those around? Yes, I can.
Okay, so she's passing those around. I want to remind everybody, our in-person meetings are until 10:30, so we're actually on time. There are until 10:30 so that we can encourage more networking, okay? Yes, ma'am.
Lisa Ackerman, I'm an independent health advocate, registered nurse, but I also am the current president of the Case Management Society Fort Wayne chapter.
Okay.
And this organization represents anyone.
I'm sorry, say that again, Lisa, I didn't hear you.
Our organization is the Case Management Society of America, Fort Wayne chapter. And the Case Management Society of America, CMSA, is an organization that's opened membership for particularly case managers because we offer continuing education credits in our education events. and social workers.
Mm.
So April 13th, we are hosting our annual conference. It'll be at the Innovation Center. We only have a save the date out there right now. But our title is Social Determinants of Health, Narrowing the Gap Between Surviving and Thriving. And Sharon is one of our speakers.
I am for that.
Yes.
Yes. I'm like, this is sounding familiar.
I wondered if she kept on that. I saw the center page and she's like, I know. Dr. Goodwine from the Board of Health is one of our speakers. Tara Morse and Jamie Farron with Indiana 211 are speakers. And Melanie, I can't remember her last name, with the Indiana Hospital Association. She's with Quality. Just case managers are your friends. If you're ever in the hospital setting, especially those who are struggling with determinants of health, they need to understand that a case manager really is their best connection in the hospital. So I'm trying to promote that. I'm really on fire about just connecting people in the community to understand what happens when you're inside a facility and how to get out of there safely, and the best options for when you leave. So we're just trying to promote better health in our community.
Awesome. Okay, yes, come to that. I'll be there. Anyone else have anything that you want to share? Felicia.
There's something in the chat from Elka. She just wants to give the group a general reminder of the Center for Nonviolence, that they provide free support and advocacy services for survivors, fee-based intervention services for those who use violence, and free prevention services for youth. So if you want to find out more, you can look at their website, which is the Center for Nonviolence.
Awesome. Anyone else? Connie.
So I'm Connie Heflin with SuperShot. Just to give a quick update, SuperShot is now open 5 days a week at our Hobson Clinic, where it used to just be 3 days a week, but we're at our Hobson Clinic from 10 to 7 on Tuesdays and Thursdays, on Wednesdays, Fridays from 9 to 4, and on Saturdays 9 to noon. We're also down at the Anthony Medical Center location every Wednesday night, and we're up at the Grayville Missionary Church on Monday mornings. But we also, accept adults. A lot of people just think of SuperShot as kids-only immunizations, but we accept adults, anybody, 0 to 100 plus. And we accept all forms of insurance. And if you don't have insurance, that's not a problem either. We have a process for that. So we turn nobody away for inability to pay for immunizations. So I think it's always good. So we have a permanent home now, SuperShot does. We didn't used to. We used to be on all these traveling locations. So our permanent clinic is 1515 Hobson Road, and we are remodeling the clinic, which will be awesome. And we will have sensory-friendly, there's nobody here from Turnstone, but we're going to have sensory-friendly exam rooms that are sound-absorbing, have tools for those that have sensory disorders to calm, and, all kinds of bubble walls and things like that, and social stories to really help folks that have learning disabilities, neurodiverse individuals. So there's a lot of great going on. If anybody ever wants to see a tour, anybody wants more information, always reach out.
There's a lot of great going on, and there is. Thank you. Thank you, Connie. Before I forget, we have someone on the line, so we want to get to her. But before I forget, I want to just remind you guys that if you have not been able yet to secure your payment for your dues for the membership, then please do so. There is still time. So if you want to be a member of Allen County Health Equity Coalition and you have not yet paid your dues, please do so. Contact us. Contact Felicia at fsa@hvusa.org, or our number is 745-1600. Now, Felicia, we've got somebody on the line who's going to give us some information here.
So I invited Amber Marr to the call. She's our legislative director for AARP and might be able to give us some updates on the public health bills that are going on at the State House.
Hi, Amber. This is Sharon Tubbs. I'm the director of Health Visions Midwest. Thank you so much. We had some legislative updates planned with Tony Gillespie at IMHC, and he couldn't make it this morning. So I was just wondering if you could touch on just real quick the public health bills that are circulating and under consideration.
Absolutely. So I probably will not be able to give as robust of an update as Tony. We are obviously tracking as far as AARP goes, many bills, and there have been a lot of movement with the second reading and third reading deadlines coming up. So this week was the committee deadline. So on Tuesday, it was the committee deadline for the House, and tomorrow at noon is the Senate committee deadline. So any bill that does not cross over for today, as far as the Senate bill, I mean for tomorrow, as far as the Senate bill by noon, it will essentially, that bill will die. But the language could always resurface later in session. As far as some of the public health bills, I don't know if you guys would be interested in the fact that, so Senate Bill 1 is basically the behavioral health bill that is expanding mental health services. And that one actually passed the Senate on the 13th, 49-0. So all of the individuals in the House that have signed on for that has just been referred to the House and will be going through the same exact process that it did in the Senate once the changeover happens. And that will be not next week, because those are second and third reading deadlines, but the week after. So Senate Bill 1 will begin that journey on the House side. But that was great news that it passed 49-0. The only issue that I would say is happening is that it doesn't appear as though there is any fiscal attached to Senate Bill 1. And what does that mean? Basically, the Senate had removed all of the money from any bill that had money in it. It looks as though the House, there were no funds put in the budget to actually fund these mental health, the expansion of the mental health services. So we are working on getting that into the budget. Now the budget hasn't gone to second reading yet in the House. So there's always opportunity to still do that before next week. But just know that while Senate Bill 1 is moving, there are no funds to support it, and they weren't included in the House budget bill that's coming over to the Senate just yet. But there's still a few days for things to change, and I anticipate that hopefully we can continue those conversations to get that in the budget. Yes.
So I'm sorry, this is Sharon. So if the I thought Senate Bill 1 was about expanding mental health services by expanding the money allotted to mental health services statewide. So if there's no money attached to the bill, what is the expansion?
Right.
Yes. Great question. So just so you know, and I know you guys probably know this, but all of the funds are usually tied to the budget somehow. You don't have to necessarily have a separate bill to get money into the budget. But oftentimes you will have a separate bill that explains sort of what that money will be used for in a little more of an expansive way that can be listed in the budget. So yes, you are correct. Everything that you just said is correct. But because the Senate was sort of, every time a bill had a fiscal to it, they were just removing that money and moving the bill, so that when the House bill, which is House Bill 1001, which is the state budget, moves to the Senate, then they can have conversations about this long list of things that has to have funding attached to it. So while Senate Bill 1, the funding was removed, I believe the intent for the Senate is once that House budget bill comes over, they're going to look at everything that any bill was, had any type of funding to it, and they're going to try to figure out how much funds they have to divvy that out, and if those topics and areas can all be fit into the budget, which normally they can't be. But I would say this is the long game. So while we are very concerned and we want to make sure that we continue to speak to legislators about our support for mental health services and the expansion of mental health services, I would say that we might want to wait to see sort of what happens on second reading with the budget, and then how that happens when it comes over to the Senate. Because even if it comes over to the Senate, that budget bill is going to go to conference committee, and there's still going to be discussions happening as to where that funding goes. But yes, it does have to have funding in order to expand mental health services. So that is something that if you have been communicating with your legislators, I would continue to say, please fully fund Senate Bill 1 and ensure that those funds are included in the House budget bill.
Is there another public health bill that you wanted to touch on real quick?
Yes, and I'm so sorry. I know that you guys are on a short time frame here. So I was going to mention Senate Bill 4, which is the Public Health Commission bill, which also was the expansion of public health services. So that funding that they were looking, that extra funding that they were looking for was going to go to the Indiana Department of Health. And then that was going to trickle down to the local health departments if they opted in to receive that money. So just as a, I just lost the amount, I'm so sorry. Where did that go? So I apologize, I just lost the fund. I think it was 260,000 or 260 million that I put in here. I cannot believe I just had this pulled up and it disappeared on my computer. While I'm talking about this, before I give you the wrong number, basically the moral of the story is that Senate Bill 4 was not fully funded at the amount that the governor had requested in order to have all of these funds trickle down to the local community and have all of these services increased. However, they did include a decent amount, but that it still wasn't what was requested. So we will continue to work on getting that fully funded at the amount that was requested by the Department of Health. And if you can give me just 1 second while you guys continue on your conversation, I'm happy to drop it in the chat so that I get this information correct to you. But just so you know, Senate Bill 4 is currently on third reading in the Senate. There were some amendments that were offered. Some went in, some didn't. So they are still sort of communicating as to what this bill will look like and how they want this done. They really do want the local communities to have say. They don't want the state to be able to dictate what local communities can offer. So there's a lot of that discussion too about maintaining local control with the services that they provide, but also helping the state still be able to have some of those services evenly across the state for individuals who have opted in for that money. So hopefully that helped explain that a little bit, but it is still moving and it will be on third reading tomorrow, I believe, or even they can pass on it and it has to be passed out by next week on Tuesday. So, yep.
Amber, thank you so much for hopping on. Just thank you. That information, that is much appreciated. So basically, we want to be in favor of Senate Bill 1, which is the expansion of mental health services, and we need some funds attached to it, and also Senate Bill 4, which is an increase in the amount of money that is allotted to our local public health departments, correct?
Yes, that is correct. And my apologies, I promised you that if I would have been more prepared in a different way. Well, I'm so sorry. This is so off the cuff, but I wanted to make sure when Emily reached out, I was like, yes, I can hurry, because Tony, I love Tony, and I hope he is feeling better.
Yeah. Yes. And so we want to definitely reach out to our legislators and talk to them about those bills. We can look those bills up, read the text of them online at the General Assembly website, which I don't have off the top of my head, but we can go there, Indiana General Assembly, we can look up those bills, we can read them, and we can contact, just send a note or a call or a message to our legislators here in the area where your organization is and say, hey, I want to voice my support for Senate Bill 1. I want to voice my support for Senate Bill 4. Okay? Does that make sense? Is that right, Amber?
Yep, that's perfect.
Okay. All right. Thank you so much. All right.
And I will be sure that I will drop that amount that was in Senate Bill 4 in the chat. If you I'll stay on for just a little bit so I can get that in the chat for you.
Okay. Yes. Thank you. Denise, you had one last thing?
I would like to recommend as ACHEC that at least once a year we have a recap of legislative / financial, fiscal sorts of things, just so we're all on the same page as we go through of what's going to happen. I'm not going to be the person that's going to sit in that stuff, but I know how important it is to have somebody keep their eye on the prize so that we get to the destination we thought we were going to.
Yes. So you mean not what we were doing today, but you mean like at the end of the session? Is that what you're saying?
Well, sometime in the first quarter of the year, each year, you need to have this kind of a conversation.
That's what we've been doing. So that's what we wish, that's what we wanted to do this year. And Tony has come for the past couple of years and given like an update. And so Yeah, so we want to be sure that we know some of the bills and things that are going out and that are being considered where they are, and so that we can voice our support for that. All right, thank you, Denise. Anyone else? Okay, so it is mingle time. Thank you so much. Thank you so much for those who came and joined us online. Are there any other questions online or comments, Felicia?
Not yet. I know Amber was still looking for.
Oh, Amber is so wonderful. Isn't she diligent in trying to get that number for us? Okay.
Okay, here I got it. It says, Holcomb wanted to see 120 million in fiscal year 2024 and another 227 million in fiscal year 2025 to increase public health services across the state.
Okay, but that's not what they gave us.
So the House gave a total of 225 million overall for this earmarked for public health. And that is still an increase from the 7 million a year that the state currently gets.
7 million.
So they've increased it 7 million, but as you can tell, the total of 225 million total is a lot less than what Governor Holcomb had requested, which was 120 million in the first year, and then 227 million in 2025. And that is not, it definitely falls short of that request.
Okay. Thank you, ma'am. Okay, so thanks everyone. Thank you, Amber. We really appreciate you. Thank you to Emily for reaching out to you. And thanks everyone for showing up today. It is mingle time. Please, Mary mentioned apples. You wouldn't have believed how much one apple a day would increase your health. We have plenty of apples over there. We've got other stuff. Please eat that, take it, and be well. And mingle amongst yourselves. Thank you. So we